Hello, my name is Dr. Mohammad Hasnan and I am currently working as a resident in general surgery at Mayo Hospital Lahore in West Surgical Ward, and today we will be describing the WHO protocols for the patient undergoing surgery, which is truly called as WHO safety checklist. So let's move on.
Hi, I am Muhammad Umar Iqbal, working as an anesthetist in Mayo Hospital, Lahore. I am going to check the patient one last time before operation. अस्सलाम वालेकुम जी। मेरा नाम डॉक्टर उमर है। क्या नाम है आपका?
मोहम्मद अब्दुल्ला।
किस चीज़ का ऑपरेशन आपका?
मेरा दाईं तरफ हर्नी है, उसका ऑपरेशन है।
ऑपरेशन वाली जगह पे निशान लगा हुआ है?
जी, निशान लगा हुआ है।
दिखाएं ज़रा।
जी।
किसी दवाई से एलर्जी तो नहीं है आपको?
जी नहीं।
We have confirmed identity, procedure and site, and we are not expecting any difficulty in intubation, and pre-operative antibiotics are given, so let's proceed.
So at the sign-in, the anesthetist and his assistant has confirmed the patient's name, procedure and the site of surgery. And the anesthetist has also confirmed that the patient is not allergic to any medications, and they are not expecting any difficulty in intubation, and pre-operative antibiotics are already given. As the patient presented with large inguinal hernia on the right side, so anesthetist and the surgeon decided to proceed under general anesthesia. This completes our sign-in.
Ready for the timeout according to WHO checklist. We are going to reconfirm patient's name. That patient is Muhammad Abdullah, son of Muhammad Usman, and he is going to be operated for right-sided inguinal hernia, and the surgical site is already marked yes. So patient is not allergic to any medication, and we are not expecting any significant blood loss.
Yeah, we are all set. Diathermy is ready, antibiotic given, and we are not planning any biopsy sample in this procedure.
So is everyone happy and ready to start?
Yes. Sure.
So let's move on.
So at the timeout, surgeon and his team reconfirmed the patient's name, procedure, site and site of surgery, if any imaging is available, and if the patient is allergic to any medication. And they have also checked if they are expecting any blood loss in this surgery. And the team also confirmed the functionality of diathermy, either antibiotics are given or not, whether they have planned any biopsy specimen in this surgery, warming on, and WTE prophylaxis on. This completes timeout. After the completion of timeout, surgeon proceeds for the surgery.
So everyone is ready to proceed for the surgery?
Yes.
Sister, knife please. Sponge. So we are done with the surgery. Time to sign out. Can we just sign out please?
Yes.
Procedure recorded as?
Mesh angioplasty of right inguinal hernia.
Is count complete, sister?
Yeah, it is complete.
Packs removed.
Yeah.
Line flushed.
Sister, any equipment problems?
No, there is no specific equipment problem.
That's good. Any specific concern in post-op plan?
Yes. Tight underwear and scrotus spot.
That's good. Is this a day case?
No.
Well, we are done with the surgery and we have completed our WHO checklist as well. So thank you everyone.
Thank you.
So after the surgery, the whole theater team performed sign-out. In this step, they reconfirm the procedure they have recorded. If the count is complete, biopsy specimen labeled or not, packs been removed, lines flushed, any equipment problem, and if the surgeon has planned any specific post-op plan in the surgery, WTE and antibiotics plan, and if the surgery is a day case or not. This completes sign out.